Dear attendees, a very warm welcome to the Healthcare Scholarships and Careers Fair 2022. My name is Yi Hui. In this session, we'll be discussing the Healthcare Scholarships and Careers webinar that is jointly organized by MOHH and SGExams. And we'll have Fook from SGExams who will be moderating the dialogue, and 4 scholars from the various health science disciplines and administration disciplines to discuss about their experiences as MOHH healthcare scholars. After the panel dialogue, we'll have a Q&A section where we will answer questions from the floor. Some housekeeping announcements before we get started. In your event window, you'll be able to access the Q&A function. You may type your questions there for the speakers to answer during the Q&A segment. Do note that in the interest of time, we'll focus on the top voted questions. And should your questions be unanswered, you may head on to the Q&A and event feed to ask them, or you may drop us an email at talent@mohh.com. Don't forget to check out the game section to participate in our quizzes and prizes to win attractive prizes. And a polite reminder that although we have a leaderboard contest going on, please do not spam questions or ask duplicate questions. This is for the benefit of everyone in this session. And without further ado, I would like to hand the time over to Fook, who will kickstart the panel dialogue. Fook, over to you, please. Thank you.
Okay, thank you, Yi-Hui. So I'll be sharing the screen right now. Okay, good afternoon, everyone. Thank you for joining our session today. So my name is Fook and I'll be your moderator today. So just a brief introduction about SGExams. We were established in 2017. SGExams is the nonprofit organization dedicated towards supporting a better student community. By focusing on academics, student welfare, education and career guidance, as well as holistic development, we aim to serve as a go-to hub for students throughout their education journey. These are our social platforms that you may follow. And just a bit about MOH Holdings. MOH Holdings is the holding company of Singapore's public healthcare clusters, National University Health System, National Healthcare Group, and Singapore Health Services. Sharing the Ministry of Health's vision to champion a healthy nation and ensure that our people live well, live long, and with peace of mind, our role is to enhance public healthcare sector performance by unlocking synergies and economies of scale. So these are MOH Holdings, a social media platform that you might want to follow. And without further ado, I will be introducing our panelists today. So first we have Claudia. Claudia, you may unmute yourself and introduce yourself.
Hi everyone, my name is Claudia. I'm currently studying Prosthetics and Orthotics in the University of Strathclyde, Glasgow. And right now I'm writing my dissertation. And some of my hobbies include reading, crocheting. I like to watch true crime documentaries, and recently my big thing has been playing escape room games. Thank you.
Thank you, Claudia. And next up we have Mr. Tan Jing Rong.
Okay, hi everyone, I'm Jing Rong. I'm currently studying at SIT, Singapore Institute of Technology. I'm studying Occupational Therapy. Yeah, so it's my 4th and final year, so I'm currently writing my thesis as well. Yeah, so some of my hobbies include playing video games with my friends, going for runs, and traveling. But traveling hasn't been possible in the past few years, as we all know why. Yeah.
Okay, thank you, Jing Rong. And next up we have Ms. Diana.
Hi everyone, my name is Diana. I'm a staff nurse at SingHealth Community Hospital, and I graduated from Singapore Institute of Technology and also University of Glasgow. So currently attachment with Sengkang General Hospital and Punggol Polyclinic currently. And then my hobbies are also, I love to cycle and sightseeing with my families. And then during free time also I will do cooking with my kids. Yes.
Okay, thank you, Diana. Next up, we have Mr. Vincent.
Hey, hi everyone. I'm a Senior Assistant Manager at National University Health System. I'm doing corporate planning. This is my 4th to 5th year working in NUHS since I graduated from Nanyang Technology University with a degree in business administration. Like many have said, we like to travel, but unfortunately due to COVID, travel has been disrupted for the past 2 years. But we are seeing the light of the rainbow soon as traveling seems like can take place. Yep, over to you.
Okay, thank you, Vincent. So just an overview of today's schedule. We'll be having our panel discussion until 4, and then after that, from 4 to 4:30, we'll be having a Q&A session. The Q&A session is open from now until the end of this webinar, so feel free to key in any questions you have for our speakers. And without further ado, we'll jump right into the first part of our discussion today. So the first part is what inspired our hearts. What motivated you to pursue a career in healthcare and in the discipline? Maybe, Claudia, do you want to go first?
Okay, thank you, Folk. So I'm studying PNO, Prosthetics and Orthotics. I always wanted to do healthcare because I was thinking about a career in which I could interact with people, yet kind of get, at first it started out as self-satisfaction. I wanted to help other people and get the kind of gratification myself. But you know, it turned into a genuine want and passion for healthcare. Yeah, so I did always want to be in the healthcare industry. And in PNO, I got an interest because PNO is quite engineering oriented. We make the prosthesis and orthosis ourselves. And I know, I mean, at first that seems kind of glamorous, but it's a very hands-on way of being able to help other people, and that was the most attractive part to me. Thank you.
Thank you, Claudia. And what about you, Vincent? Did you always want to be in the healthcare industry? And if not, what prompted the change?
Yeah. I mean, I have these questions a lot of times before because I take a general degree, which is business administration. And during my cohort, there's a lot of like business degree. Normally for my cohort, they would like to go into, banking line, the general MNCs and whatnot. Then I thought to myself, what's the difference to me if I pursue other industry? I mean, I would just be waking up doing the same thing over and over again. And I think healthcare is an evergreen industry. It's very exciting. It's very diverse. You get to meet people from all walks of life, all disciplines. And I think that's kept me going, knowing that what I do today will make a difference in the life of people tomorrow. I think that's very, very meaningful. Thus, the motivation to pursue a career in healthcare. And like what I said, this has been 5 years going and never regretted that decision. Yeah.
Thank you, Vincent. Diana and Jingrong, do you have anything that you'd like to share? Maybe Diana, you can go first.
Yes, for me, what motivated me to pursue career in the healthcare basically, because I guess during my growing up years, I've seen my loved one pass on. Like for example, my late grandfather and late grandmother, they pass on. And then also I have aunt who already passed on also because due to cancer, and she battled cancer for so many years. So I guess this is the one that motivated me to join nursing. And if you ask me whether I always wanted to be in the healthcare industry, I must say yes, because I see the transition of my late aunt. She's been having cancer ever since when I was very young, and just recently, a few years back, she passed on. So basically, I'm still here in nursing. I started as nursing 15 years back as an enrolled nurse, and now I'm still pursuing my nursing. Yes.
Oh, I see. Very sorry to hear about that. Yeah, I agree. I think that most of us who decided to pursue healthcare in a career in healthcare, we are all inspired by the desire to help people around us. Is that the same for you, Mr. Tan, Mr. Jinggong?
Hey, so for me, actually, I didn't really have a clear route that I wanted to go healthcare until I was in my 17, 18 years old. Yeah, so I think previously in secondary school, I was quite fixated on wanting to do civil engineering. Yeah, but then after I went to JC, I changed my mind because I joined this CCA called Interact Club, where I went down to a specific beneficiary on a weekly basis. So it was a long-term thing and not like one-off CIP events. Yeah, so I think through that, I felt that I really enjoyed the process of like developing a bond with like the clients that I see. Yeah, so in that case, it was with children, for primary school children. Yeah. Then I was also inspired by my sister because she's currently a nurse. And previously, she was actually volunteering on a weekly basis, even though like she had a lot of things going on in her life. Yeah, so then after that in J2, I went for a healthcare attachment program by MOHH. Yeah, so that actually opened my eyes to OT, occupational therapy. And through that, I realized that I felt that as OTs, we get to know the patients as a person and not just like by their conditions, disabilities, or them as a patient, but rather the person themselves. Yeah, and I feel like the bond that we have during the rehab journey was something that I really enjoyed. Yeah, so I think for me, I felt that joining the healthcare industry was a way where I could help people do the things that they want to do every day, which I can't imagine not being able to do. Yeah.
Okay. Thank you, Jingyong. So let's move on to the next part. So what do you actually do? So maybe we have a few disciplines here. Mr. Jingrong is an occupational therapist. Ms. Diana is a staff nurse. Claudia is currently studying prosthetics and orthotics, and Mr. Vincent is currently working as a manager. So I think maybe Claudia and Vincent, you want to share first about what does your job entails, or possible job opportunities entails. Vincent, do you want to go first?
Sure, happy to do so. Maybe I'll share a bit. I have been in healthcare, not a long time, but also not a short time, 5 years. Fortunate to be rotated to two separate departments. The first being essentially a startup where we look at future challenges of the healthcare, and based on that, the management came out with something to look at problems that Singapore are facing, and these centers are supposed to address them, such as aging. We have training professionals. We have mind science, which deal with mental wellness, which is a concern today. So my role at that time as an administrator was actually how to develop the centers to be relevant to Singapore context, and also helping it to be established. So fast forward 2 years, very thankful that the two centers are now recognized not only nationally but also internationally, where our centers director are often invited to overseas. For now is Zoom, of course, to do speech and also to share their programs and success over the years. Following that, after my first rotation, I went into corporate planning. Similar role, but this time it looks at how the vision of NUHS, which is the healthcare institution I am in. And as many of you all know, healthcare is a very diverse industry. We have all walks of life, many industries, many professions, not only medical, nursing. We also have people from the engineering, from accountancy, from marketing. So how we connect everybody together, I think that is interesting. And also as an administrator, of course, I think some of the challenges that we face is, of course, all the medical terms, right? I mean, as an administrator, you will know all the difficult terms. I think understanding and learning how to speak and interact with other professions, I think that's very interesting to do. I think I have a lot more to learn, and look forward to hearing the rest of the speaker's experience also. Over to you.
Oh, just hold on a while. So maybe can you share like one of the challenges you faced during your work experience, and how did you overcome it?
Maybe something recent. During the COVID pandemic, I was tasked to manage and lead swab center, so a swab isolation facilities at a particular hotel. I think that's one of the main challenges, because it's something very new to me. Never do ops outside of a hospital, and it's within a short time frame that we have to set up the whole facilities to accommodate our foreign workers. So I think the biggest challenges was how to work within the short time frame and working with all the departments such as infection disease control to manage and prevent a possible outbreak in SWOT isolation facilities, and also how to work with multiple agencies like Singapore Police Force, MOH, Singapore Armed Forces, Cisco, adjunct nurses and doctors on bringing people to work alongside our staff. I think that's challenging. And of course, happy and thankful again to share that after 3 months of operations, we have zero infection across not only our foreign workers and also our nursing and all the relevant ancillary staff. So I think that was the big challenges.
I'm very glad to hear that. So just to clarify, right, is it your role is to come up with an operation plan procedure for everyone to follow, or what does it actually look like? What do you have to do?
For the SWOT isolation facilities, you are right. I have to come up with the operational plans from the point where the foreign workers step out of the bus to the SWOT isolation facilities. What are the touch points? What are the processes to the point when they are bring up to their hotel room, and after they are discharged from the place, what is the step-by-step procedures?
I see.
Yeah.
Okay. Then okay. Maybe we can move on to Claudia.
Okay, thanks.
Thank you, Vincent.
Okay, so hi everyone again. I'm studying prosthetics and orthotics. One of the most common questions we get is prosthetics and what? Orthodontics, orthopedics. Okay, yeah, so I'm studying prosthetics and orthotics. So my course includes both of them. Prosthetics is, replacement limbs when you get an amputation, and orthotic devices, you don't need an amputation to use those. They can include back braces, insoles, and ankle foot braces, and yeah, those all fall under the branch of orthotics. And I think many people forget that prosthetics and orthotics include this factor, so they join prosthetics and orthotics and then they're surprised that we're suddenly doing orthotics, and they're like, what is this? I didn't sign up for this. Yeah, but another thing that people don't kind of misunderstand about our course is that we see the patient, we prescribe what we think is best, and we are involved in the manufacturing process for it. In Singapore, we are more, the technicians are quite, like they take the front role, but we are involved as well in the fitting process, the alignment process, all the way to the end. So it's quite engineering oriented, and that is why we are in the biomedical engineering branch. Yeah, and so I myself was kind of split between healthcare and engineering at the start. So this is why I kind of chose this course as well. What I like most about my, sorry?
Oh, I was just wondering, like, how did you find out about this, this discipline? It sounds like quite niche, right?
Yeah, surprisingly, I've always known that I wanted healthcare. So I looked out for emails, like I went to ACJC, and ACJC was very higher education oriented. So they sent out a lot of emails about like talks about future careers and talks that we could go to. And one of the talks was about MOHH outreach for prosthetics and orthotics. And I just kind of went for everything I saw because I wanted to be sure. So I went for it and I was like, this fits me. And yeah, so yeah. MOH gives a lot of good talks.
Okay, thank you. Maybe like, would you like to share about like, if have you had any experience working one-on-one with a patient, and like what was the process like, and how like how do you approach the problem, and how do you solve it? Just briefly, if you can.
Yeah. So this is involved in this is related to what I like about my course, is because I think I was quite sheltered and meeting a lot of patients, because in my course we do a lot of patient interaction, and I think I get to hear a lot about their stories, and like that is kind of the reason, like it really opened my eyes to a lot of like illnesses and conditions that can actually lead to further like problems like amputations. And some challenges will probably not course related, but probably just the time difference, like talking to my friends and all that, because now it's only like barely 7:30 and I'm quite sleepy.
Oh, I see.
Yeah. And overcoming, just stay strong.
Thank you. Okay, then next up to Jingrong, do you want to share about what does your job entails? And any interesting facts you'd like us to know?
Okay. For occupational therapy, OT, I think one of the most common misconceptions is that we provide like job counseling or like career advice, but that's not really true. Yeah, so that's one of the main misconceptions. So instead, OTs provide actually try to help people do the things that they want to do, need to do, and are expected to do. So this can include daily activities like brushing your teeth, showering, wearing clothes, and also expands to things like taking public transport, navigating the community, and fulfilling their job roles. So in terms of jobs, we do help people to prepare for their jobs, like obtaining the soft skills or like the social and cognitive skills that they need to meet the job demands. So this is particularly the case for example, mental health patients. Yeah, but we don't provide like job counseling and all. So I think that's more career counselors. Yeah. So as OTs, we see people from all walks of life, from infants all the way to end of life, including palliative care patients as well. Yeah.
What do you like the most about what you're doing right now?
I think
You can pick one.
I think one of the things I like most is the creativity that comes with it. I mean, I'm not a very creative person, but from time to time, I do enjoy like the challenge of trying to come up with creative interventions like treatment plans for the patients. Because as OTs, we want to help the patient do, for example, like specific occupations, activities that they want to do that like the way that they do it at home or in their own natural environment. Yeah, so let's say in an acute hospital, like in that, yeah, so in an acute ward, after someone has suffered a stroke, then I'll have to try to think of how I can simulate the environment in the ward. Like for example, if the client was a housewife who used to hang clothes, then like how am I supposed to create that environment in the hospital in order to see how well the patient is able to do it now, and how can I then help them improve that. Yeah, so then I'll have to think of ways like using let's say a walking stick or the drip pole, balancing it securely somewhere, and like making use of the environment to try to simulate the patient's home environment. Yeah, so I think that's something that I really enjoy.
That's really interesting. Then I hear that you usually come in like during the acute, like how should you put it? Like, can you share more about like what are different like scenarios where your job will have to intervene in order to help the patient? Like maybe, yeah, wait, how should I put this? So do you always come in whenever a patient is in need, or how does it work?
So let's say a patient like first suffers a stroke. I'm just going to use stroke as an example. Yeah. Then so they'll go to an acute hospital like Tan Tock Seng, SGH, CGH, etc. So after they first get admitted to the hospital, then the doctor normally refers the patient to like OT, PT, physiotherapy, etc. To see whether or not they need our intervention. So we'll step in to assess whether or not they actually need help in completing their daily activities. Yeah, so things like brushing teeth, grooming, wearing clothes. Yeah, so after if let's say they face some difficulties with those activities now, then that's where we step in and provide our treatment and interventions. Yeah.
Okay. Thank you, Jingrong. Now let's get Diana. Would you like to share about what you actually like? What is your job entails?
Okay, so basically I'm a recipient of the Community Nursing Scholarship. So when you are a Community Nursing Scholarship, once you graduated, you will have to undergo a 6-month attachment in the acute ward, which I was attached to Sengkang General Hospital. And currently, I'm on another 6-month attachment with Punggol Polyclinic to see how the patients are being treated or receiving treatment, or how the nurses handle patient out in the community. So basically it's a two different discipline. So first is the inpatient ward, and now is I'm going into out in the community. So and after that I'll be going to community hospital. So through all this transition, right, I'll be able to see different cases, different patient diagnoses, and how all nurses in different discipline managing the patients. So out in the back in the community hospitals, we will see patient, we will take care of patient, those who will require rehabilitations, will require all their ADLs, their assisted daily living. We will assist them to do. We will help them to regain back their function, because maybe they are admitted into the hospital because of some surgery, and they may have functional decline when they are in the acute ward stay. But then once they go to community hospital, we will assist them. And I believe all my colleagues in the occupational therapies as well as physiotherapists, they will help them to regain back their functional. Yes.
Okay.
Yeah. So.
Yeah. Sorry. Would you like to share more?
Yeah, the reason why I choose community nursing is because we know that our aging population is increasing, and a few years down the road, we will have at least about 1 in 5 or 1 in 4 all elderly populations. So with the increase of elderly population, definitely there will be a lot of people getting more sicker. So I want to be part of their recovery journey lah. So basically that's why I'm in the community sector now. Yeah.
Okay. Then I think one of the common questions that we usually have, like for nurses, is that like how do like doctors and nurses work together in the hospitals? Maybe is there like a scenario you'd like to share with us?
So far when I was in the inpatient ward, so far doctors and nurses, they work well with each other. Is because nurses, we see patient 24/7. We care for the patient 24/7, and we are also the patient's advocate. So in the event like patient has any changes or deteriorate, or there's any needs to escalate to the doctors, we will definitely inform the doctors. And during the doctor's round, like especially in the morning, like morning ward rounds, we will also because in the ward is very busy, so at times if there's times, we will also follow doctors to make rounds with the patient to understand the patient condition better. And we also can plan with the doctors. For example, we can give suggestions to the doctors based on what the patient present with. Yeah, whatever their condition, like for example, maybe they do not have caregiver at home. So if let's say they want to discharge, so what are we so what can we plan for the patient? For example, maybe they have to refer to MSW or refer to community hospital for support. Yeah.
Oh, I see. And then I also heard like there are different also like scenarios where nurses come in, right? So maybe can you share more about that? Like I heard like there's like ICU nurses, then there's like nurses who works in the operation theater, right? And how's it different from your what you're doing right now?
Yes, definitely is different, because nursing is very broad. It's a very broad field. So for example, if nurses work in operating theater, they basically deal with patients, they assist surgeons to do all the operations. And whereas nurses in, for example, emergency department, they do different things. For example, they see patient in the emergency department and they give treatment. And for example, they can see patient, they will triage the patient, and they will also see which one is the priority need to be, for example, they will give priority like P1, P2, P3. So which one is the urgent, which one is non-urgent. And then for nurses in the ward, we see basically more stabilized patient as compared to ED nurses, because ED nurses, they see when the patient is at their worst. So when they come to the hospital, when they come to the ward, patient are more stabilized in a sense. Yeah.
Okay. Thank you, Claudia. Is there any sorry, thank you, Diana. Is there anything else you'd like to share? Okay. So next up, we'll move on to the next part about our panelists' experience when they were studying. So we have actually right now, Claudia is studying at the University of Strathclyde at Glasgow. So maybe would you like to share with us how has your experience been so far? And since you're studying overseas, maybe you can share more about like, you know, any challenges you are facing. What do you like, what you do not really like? Yeah. Okay.
Okay.
The floor is yours.
Thank you. Okay, yeah. So the biggest thing is, of course, the time difference. But I think, yeah, I mean, it's just give and take, I guess. It's just, yeah. um, I think a big misconception, not misconception, but something that people believe about overseas unis is that, life is easier, grades are easier to get, and kind of pace of life is slower. But, oh, it's, I think it's, yeah, everybody here is, I mean, there's no point to compare, of course, your grades, because in the end, you study for the patients that are going to receive your care in the future. But yeah, I think that is just, you'll be surprised. It'll be able to keep you motivated to keep pressing on and doing well. My undergraduate course here is actually quite, like I had 9 to 5 days several times a week. It's tiring and a bit strange in an unfamiliar environment because I lived alone for the first 2 years, and now I live in a shared flat, so I live with other people, but I lived alone in the first 2 years, and I think it really was quite difficult because when I wanted to speak to people, there wasn't really anyone to speak to. My Singaporean friends were out of the topic because it was like the time difference was just a bit difficult. But I think gradually I managed to become more independent and to make it by myself. Before this, I didn't cook at all. Now I can cook a bit. I used to burn Maggie mee. Now I don't burn Maggie mee. You know, if you're wondering how I burn Maggie mee, yeah, let's not talk about that.
Then maybe like what's like the silver lining, or like what makes the challenges not so challenging during your time there? Like what helped? I don't know. Any
Perhaps the weather, but also not really because it rains a lot here.
I see.
I would say it's because this is where I wanted to be. Like when I was in JC, I really wanted to study this course, and I really thought that I should go overseas and I should get more perspective because, like I said, I was quite sheltered. And so I'm really happy to be here in the sense where I get to develop by myself rather than influenced by my parents and the Singapore system and like environment.
Okay. Then can I just ask, right? So how long is your course, and like do you usually have like maybe like first 2 years you just study, then third and fourth year you have clinical? Is it the same for prosthetic and ortho? Sorry, I also don't know how to say
Exactly.
the name.
Yeah. No, it's fine. No, so for our course by right, we spend the first 2 years like kind of mix of practical and theory. We do get interactions with volunteers and stuff because we can't just cut off our legs to practice on prosthetics, but so we do get like amputee volunteers to come in and we practice on them. Same for orthotics for the first 2 years. And by right, our third year we're supposed to be on placement, and our fourth year we come back from placement to do our dissertation. But because of COVID, they said that we are not ready. So in my third year, I'm writing my dissertation. So next year I'll go on placement. We don't have those sporadic placements like SIT. We do a 17-week placement for prosthetics and orthotics. So it takes up the whole academic year for year 4. Yeah.
Okay, thank you.
Thank you.
Then maybe move on to Diana. I think Diana is also like half SIT, then half of the time you went overseas, am I right?
Sadly, no, because we was not able to go to University of Glasgow. Actually, we are supposed to have clinical attachment for 4 weeks in University of Glasgow, but because of COVID came in 2020, so everything was being pulled off. Yeah, so I was only with Singapore Institute of Technology for the 2 years lah. So basically, yeah. So basically,
sorry, go on.
So basically for this undergraduate course under Singapore Institute of Technology are for those who are already registered nurses who are from Nanyang Polytechnic or Ngee Ann Polytechnic. So for those who are interested to go, actually they will usually undergo to NUS or NYP or Ngee Ann Polytechnic.
I see.
Yeah.
So what was your time like at SIT? Like, wait, so just do you mind going like through an overview of your whole academic journey,
Okay, okay.
like where you started from? Yeah.
Okay, so I started from ITE. Then I graduated as enrolled nurse, and I worked for a few years.
Oh, I see.
So then I continued to upgrade myself. Then I went to NYP to attain my diploma in nursing. Then after that, I go to SIT to get my degree. And then this SIT program is a 2 years program. Basically, like I mentioned earlier on, is for those who are already a registered nurses. So basically, they are a graduate from NYP or Ngee Ann Polytechnic. And then for this 2 years course, what we do is most of it is in local. It's just that because of COVID, we doesn't got a chance to go to University of Glasgow. We doesn't have got a chance to see how the patient is there, how is the condition there, the environment. Yeah, I guess Claudia is actually enjoying her life there, seeing all the different patients, different patient demographic. So yeah, enjoy your time there, Claudia.
So well, I think I'm like interested in that because like there's like two different pathways, right? One is like young people like us also go directly to SIT, then after that become an enrolled nurse, whereas you become an enrolled nurse first before furthering your studies. So maybe is there like any new things that you learned, or like how is it different? Like how is it different to have like the experience first before furthering your studies?
I guess for me, when I have a certain type of, certain experiences before I go for my graduate course, I can relate better. So which means I work first and then I can relate better to whatever that I do in my SIT courses. So because whatever we learn is always good to have some example or whatever experience that we had before. Yeah, so it's easy to relate. Yeah.
Oh, I see. So what during 2 years at SIT, right? So what does the course entails?
Also, okay, for SIT, what we learn is like we do education. We have also innovations. We also have health assessment that we do for patients. So basically, the health assessment is a practical lesson. That lesson we require us to take a test, take an exam, which is also called as OSCE. And then we also have to go to clinical attachment in the ward and perform at the actual patient based on the patient conditions. So which means is based on the real life experiences. And then thereafter we have to do a case study on the patient itself. So to me, it's relatable. So you will be able to understand better and how and can relate between one diagnosis and why you do this health assessment and so on.
I see. Okay. Thank you, Diana.
No problem.
Okay. So maybe we can get Vincent to share. Like you started out as you were studying business first, right? So what was this transition like, or like how did you have to learn more things in order to become a manager in like an administrator in the healthcare industry, or what was it like?
I honestly, I think all disciplines are suitable for a role in healthcare because healthcare has many opportunities, not only in terms of medical nursing and the allied health profession, but we have all discipline. Actually, I have many friends who are business students, but they have professional degrees such as accountancy. And some of them are working in accounting, financial analysis in the various hospital. We have people in engineering. We have people even planning for the next hospital. So it's a very diverse sector, I would say, where general skills are useful. As long as you're willing to learn, that's more important. And also, as you work through the years, I think you'll gain a lot of interdiscipline skills and knowledge, which will be very useful in your career later on.
Oh, I see. So like in addition to your business course, right, do you have to like learn like some extra courses, or like you just picked up the knowledge along the way as you work in the healthcare industry?
I think there's a lot of on-the-job learning where You
I see.
you actually learn about how the healthcare works, what is the government viewpoint about public healthcare, and the direction of where our public healthcare is going to. As an administrator, I think these are the basics that you should learn, not only in terms of your on-the-job training, but also through readings. I would say healthcare is, of course, at the transition phase this time around, where we are looking into actually bringing care to the community. So I think over the next few years, be which discipline you are in, I think there's a lot of exciting opportunity.
Okay. Okay. Thank you, Vincent.
Thank you.
Then Jingrong, would you like to share about what was the course of study like and any memorable experience during your course of study?
Okay, I think compared to Claudia, thankfully SIT isn't 17 weeks at one shot. I think that's really
The
tiring.
trimester system, right?
For like each clinical placement.
Oh, I see.
Yeah, because for us we have 7-week placements, but we do it 4 times. Yeah, so at least there's like a bit of break between each placement to rest and recover a bit first. Yeah. Yeah, but SIT uses a trimester system, as you mentioned. So compared to NUS or NTU, they normally have a summer break from like May to July, August. But SIT we still have a semester during those few months. Yeah. So I think to answer the question of whether or not I don't know, to me it feels like sometimes it's stressful, sometimes it's not so stressful. Yeah. So I think like the theory part of it in year 1 and parts of year 2 is a bit stressful, but after that, when we get to apply what we learn during practical sessions and clinical practice, things like we manage to connect the dots and things become better. And there are interesting modules as well. Like we have a particular module that's on leisure, like leisure activities. So we actually learn how to do gardening and cooking during class. Yeah.
So like case study, right?
Sorry?
It's like case study for you to help like understand the different daily activities that the patient needs to do, right?
Yeah.
I see.
Yeah.
Then I'll be curious, like what do like what exams, like what are you tested for in your exams?
So I think it depends on the modules itself. So like all the theory-based modules have like it could be written reports like in a group or presentations. Yeah, but there are also or like reflection pieces, things like that. But then about the other modules on practical have practical exams. So for example, we also have simulated patients who will come in, like what Claudia and Diana said for their course. Yeah, so for example, there will be case scenarios where like a simulated patient, like someone who's like hired by the school to be a simulated patient. So then they will simulate having like having a stroke or like having fractures. Yeah, so then we'll have to on the spot like think of a treatment plan or like talking to them. Yeah, because in the healthcare industry, it's not just about like being able to carry out the treatments, but it's also about how you communicate with the patients as well. So that was one of the components that we were tested on too. Yeah.
Okay. Thank you, Jingo. So now we move on to the next part, which is about MOH Holdings scholarship. So, how did you find out about this scholarship, and what was the application process like for you? Maybe Vincent, would you like to go first?
It's a long way back. I applied through SGIS, which is the Singapore Industry Scholarship for hospital administration. So who would you recommend this scholarship to? I would say you are interested in the healthcare, you are interested in an evergreen industry, the industry that is always growing, a place where you can work with people that things like you, caring, and people who generally care for each other. So a place where work-life balance is very important. If you value all this, I think a healthcare industry is suitable for you. And if you are not into nursing in terms of patient facing, then I think if you still want to be involved in the industry, then I think administration role would be suitable for you.
Okay. Okay. Then, do you still remember what was your interview like, or the selection process like?
I think it's quite straightforward. And I can't really remember much of the details, but an interesting question that I always remember that the panelists actually asked me, what is more important to you, working hard or working smart? I think that struck me the most during my interview questions. I choose work hard because as long as I work hard, the results is secondary. So I think it's interesting now where in terms of I've been to other scholarship interviews, and this is one, they really treasure your character more than anything and your passion. Yeah.
Okay. Thank you, Vincent.
Yep.
Maybe you should get someone who's more familiar with this process, like Claudia, since you're still studying. That means you just had your application process done recently, right? I mean, probably 4 years ago, but it's still quite more recent than the rest. So maybe can you share about how was the application process? What were some challenges you faced? And what was the interview like, if there's any interview?
Yes, I can remember.
No stress.
Yeah, so I think you just apply normally through Bright Sparks. I just applied for everything I saw. I wanted to apply for this, of course. The Bright Sparks application process is quite straightforward. I think, if I remember correctly,
Okay.
yeah, I think probably Yi-Hui will probably be better able to explain that than me, because I think Bright Sparks is just straightforward. For the interview, I think as Vincent said, I think they do really value character, and that's what they're looking for. Because at my interview, I really didn't do well. I had no idea what I was talking about, and they called me out for it, for barely knowing anything about my course, the course that I was applying for. Not that I didn't know enough, but I had some grave misconceptions, and they gave me the chance to do 1 day of attachment and decide after that if I was still interested in my course. And I think, and that really allowed me to understand and rekindle, I think, the passion that I had. Yeah. So
I see.
Yeah.
Was there a lot of applicants when you applied, or just?
I think there were 3 of us, and we all went at the same. No, there were 3 people on that day. Yeah, but I was the only one for my year alongside another NS boy. So there were 2 of us.
Oh, okay. Any memorable experience? Oh, I mean, apart from the being called out.
Memorable experience within the process, or
any interesting questions, any tips you'd like to share with our audience today?
I would say that if you do search, if you do have a passion for what you are applying for, I think that will be very obvious to see to the people who are interviewing you and to MOHH. So I would say pursue your passion if you have it, and don't be afraid if you're afraid of competing with a gazillion other people. Your passion is the brightest.
Wait, then why did you decide to take a scholarship?
And because this course could only be pursued overseas, and I think it was something that was a bit much to ask of my parents. Yeah.
Okay. Thank you, Claudia.
Thank
you. Okay. Vincent and Jingon, do you is there anything you'd like to share about the scholarship? Diana and Jingon, is there anything you'd like to share about the scholarship experience, or else we can move on to the next part?
I think mine was also quite long ago, so I don't have a lot to contribute for that.
Okay, thank you. Diana? If not, then okay. Okay. Then we'll move on to the next part, which is maybe sorry, Diana again. Maybe can you share about what is a career pathway like for community nursing?
Okay, so for career pathway for nursing, I guess we can look forward into clinical. You can look forward to become a nurse clinician track. You can look forward to become a education, whereby you will become a nurse educator. You can also go into research. You will become a nurse researcher. So there's a lot of other specialty that you can venture into after you already attain maybe a few years of experience. So for example, you can go into maybe become a specialty nurse, for example, like a wound nurse. You can go into a diabetes educator, whereby you educate patients who have diabetes. You can go into renal specialization. You can become a renal nurse. So there's a lot to it actually. There's more. There's a long list. So I believe that if you really have passion for nursing, you give it a go and read up more on the how to say
Career prospect?
career. Yes.
The pathways, I see. Then wait, I'm just curious, right? So your job right now is a staff nurse, right? Then if you don't mind sharing, what would happen like if you get to promote, like what's like your promotion, the next promotion job?
Sure. So for me, I started as a staff nurse 1. So now my next promotion will be towards senior staff nurse 2, followed by senior staff nurse 1, and followed by assistant nurse clinician, ANC, then followed by either you want to become NE, nurse educator, nurse clinician, or nurse researcher. Yeah.
Oh, I see.
So if you want to advance forward, you can go into taking master in nursing, and you will become an advanced practice nurse.
Oh, I see.
Yeah.
So you can also choose to like just stay like in your position right now, right?
Sorry?
But it's like, must you promote, or can you decide to just stay where you are right now?
Definitely everyone will get an equal chance to be promoted. Yeah. So if you are a staff nurse, within a few years you will be promoted to senior staff nurse. Yeah, provided all your you have a good conduct, that kind of thing. Yes.
Okay. Thank you, Diana.
No problem.
Then what about Vincent? Can you share with us what was the career pathway like for you as an administration scholar?
So firstly, I want to assure the attendees that your skill as an administrator, a healthcare administrator, is definitely in demand across many industries. So career pathway wise, I would say it's very varied based on your interest. As you might read in the news, Singapore is actually building up our healthcare capabilities not only in terms of our community healthcare programs, and also they are actually building a lot more hospitals and also polyclinics. So in terms of growth, in terms of the many opportunity around, I think there's extensiveness of what you can do and what you like to do. So I really think it's an industry that one can find a fulfilling career. Not only that, you know that at the end of the day, what you do make an impact. Like you actually can see how your decision and how your teamwork and how your work impact the life of Singaporeans at the end of the day. Yeah.
Thank you, Vincent. Maybe can you share more about like since like after you become a scholar, right? What was like the whole career path was like for you? Or it's like, do you get promoted to a high position, or how is it?
I would say the scholarship give you a lot of bullets, a lot of ammunition of first step into the healthcare career, because it prepares you well enough. Firstly, it gives you the required network. So even in your university days, we already know fellow scholars, which actually we still depend on them for some information or some help when we are working. So that's the first thing. And I would say promotion is really, although the scholarship give you some help in terms of the network, the information, the knowledge, but mostly it's still dependent on your work ethics. I would say at the end of the day, your RO, your boss will grade you based on how you perform. But from what I have seen from my scholarship friends that are from my same batch, many of them are doing actually very well. They are well in knowledge across the healthcare industry in the public sector. And many of them has went to take on heavy roles and has been rotated across various departments. So I think that is a testament of how well the healthcare administration scholarship has done to us scholars.
I see. Also, so from what I understand, right, that you can either go to the private healthcare sector or the public healthcare sector, right?
Yeah, actually, I have friends who also went into back into the civil service like MOH and other government sector because their skills are relevant in terms of planning. Yeah.
Okay. Thank you, Jingrong. Sorry. Thank you,
No,
yeah. Okay, then Jingrong, would you like to share about what was your career pathway like? You said that you were gonna be promoted to a acute hospital scenario, right? Then may I know if there's any other situations where occupational therapists can come in?
Because I haven't started work yet, so I can't share too
Why
much
did you
about.
decide to go to acute hospitals and not any other places?
I think, okay, for me, I'm going to an acute hospital because I'm born there, so I don't have a choice in that.
Oh,
but,
I see.
But actually, given the choice, I would still choose to go to acute hospital upon graduation because I feel like acute hospital is where I can learn the most and I feel like upon when I'm a fresh grad, I want to be able to start off strong and intense and learn as much as I can before I maybe going to step down care. So step down care like community hospitals, etc. Yeah, because in acute hospital the workload is normally higher than in other settings. So I've also heard from professors and during my clinical placements, the clinical educators also shared that it's actually easier to start off intense than you step down from there. Yeah.
Oh, okay. Thank you, Jingrong. I think now we can move on to the Q&A session. So I am seeing some questions coming in from Yihui. The first question is, how many people actually enters healthcare for the money? So maybe Diana, would you like to answer this question?
If you were to ask me how many people enter healthcare for the money, I've got no figures on that. So I'm not able to assist you on that. But then if you want to think about going to healthcare because of money, I think you got the wrong mindset. Okay, going into healthcare, you have to have passion like us, like all other panelists have shared earlier on. The most important thing is that even in other setting, if let's say they will give you more money, but then it does not equate to what you are doing, I guess it doesn't make sense lah. So because I do have see some nurses who enter, they are previously from other fields, like for some of them are accountants, some of them are as stewardess. But then they enter healthcare is because they are able to relate with people. So I believe from there I can see that it's not all because of money itself. Yeah.
I see. Okay. Thank you, Diana. Then what about you, Claudia? Do you have anything to share for this question?
I would actually feel like there are not that many people who do enter healthcare for money because it might not be like a very equal exchange, I think the first impression people get is that you do a lot more work without getting a lot of financial benefit in return. That's what I think, at least, but it might be because I've only spoken to like other students.
Okay, thank you, Claudia. Then the next question coming in is, when does one usually find out which healthcare discipline they'd like to pursue? And the audience also shared that there are so many disciplines and they don't know what they would like to choose or which one to pursue. Maybe Jingrong, would you like to share? How did you decide to pursue occupational therapy? How did you find out about this discipline and why did you choose it?
I think the best way to find out is through attachments. Yeah, so for me, because my school also had like they will let us know if there were any like programs available, like the healthcare attachment program by MOHH. So yeah, so through that I managed to get a better idea of the different disciplines that were available and under allied health, and also explore occupational therapy in particular. Yeah. So I think attachment is the best way to find out exactly what each discipline does, because there's only so much we can read about it. But it's only when we actually follow the OT, for example, then you'll realize like the day-to-day life, how is it like as a day-to-day life of an OT? Yeah. And whether or not it's suitable for you.
Oh, okay, thank you, Jingrong. Okay, so my technical assistant is asking me to stop sharing the slides and get everyone to turn on the camera. So, hi everyone. Yeah, okay. Back to the question. Is there anything else anyone want to share? Maybe Vincent, how did you find out about healthcare admin and yeah?
I think MOHH website and the MOHH scholarship teams are very helpful. If you have any questions, they are more than happy to actually answer your inquiries. So I think that itself is actually a good platform for you to learn about the various disciplines, and they can also link you up with us, of fellow scholars, to guide you along. For my juniors, they actually link me up with a few of them to learn more about healthcare administration and stuff. So I think if you're really interested, there's a lot of reading materials in MOH's website, but I think more get in touch with the scholarship team. I think they can answer your question personally. Yeah.
Oh, okay. I think the question means like when you were a student, right? How did you find out about all these before you were even a university student? Because I think most of us are, when you are a JC student or secondary student, did you already find out you want to do this?
I found out this because I'm interested in healthcare, right? So that time, SGIS is already offering healthcare administration scholarship. So I mean, I did yeah, and I have more questions about it. So I attended MOHH webinar. That time is still, I believe they held like yearly events where they actually invited scholars down to share with potential students, potential applicants on what the career opportunities are and any questions they might have. So do look out for all these events. I think they are very, very helpful.
Okay, thank you, Vincent. So what I'm hearing is that just try to attend as many talks as possible, and if can, then we just join any attachments or job shadowing if we can, but it's COVID, so we don't really know. Yeah.
Okay, yeah, just that since you are young, try to learn more, try to explore more. Don't be shy to ask, don't be shy to network. I think when you are young, that's your best time to do that because you have nothing to lose, right? So learn as much, ask as much.
Yeah, I agree.
Yeah.
Okay, thank you, Vincent. Then the next question is, would you recommend separating your passion or interest and your career? I'm not so sure about what this question means. I think it's, does anyone know how to answer this question? I'm sorry, I'm also not very sure what this question means. Okay, let's move on to the next question. Would you still go into the healthcare if you knew the pandemic would be so bad? I think the best person can answer this question is maybe Diana, because I think as a nurse, you are like, currently working with a lot of patients face to face.
Would you still go into healthcare if you knew the pandemic would be so bad? I will still go into the healthcare because back then when I was young, I think at the point of time was SARS. SARS was emerging at that point of time in 2003.
Oh.
Yeah, so I thought it would be, and we saw in the news that we lost some healthcare frontliners to SARS back then. And then I don't think I will switch over, even if I know that during that point of time when I want to join, there's a pandemic. I think I will still join. Maybe because I'm already a nurse, so that's why I think I will still go into nursing. Yeah.
Oh, I see. So what keeps you motivated? Like, were you very anxious when all these things happened, and what keep you going? What kept you going? Yeah.
What keep me going, because I guess if all of us have this mindset of if there's pandemic, we don't want to join healthcare, then who would be the frontliners? Where will all the frontliners be? So for me, it's like I want to be part of it. I want to be part of part of the frontliners, to be able to care for all the peoples in the populations. Yeah. So I guess you have to have the right mindset lah. Yeah.
Okay. Thank you, Diana.
No problem.
Then what about you, Jingrong? I heard you are about to enter like the key hospitals, right? How you feel right now, like knowing that the pandemic is, not going so well? Are you very nervous, and how are you coping with it?
I think for me, I don't really have I do feel that there is an impact on healthcare workers during the pandemic, but because all my placements, except my first, like 3 out of 4 of my placements were during the pandemic. So actually I got a taste of how it will feel working during the pandemic. Yeah, and I feel like it shouldn't really affect your choice whether or not you want to join healthcare, because ultimately the pandemic is hopefully temporary and it's an endemic. Yeah, so maybe with time things will get better. But I feel like it really shouldn't affect whether or not you want to join healthcare, because depending on which discipline you go to, like for example OT, we don't really, like the impact it has had on us is more of the having to wear the face mask, etc. Yeah, and maybe like hand hygiene, proper hand hygiene, all those. But actually hand hygiene and like or like even gowns, all those, like this personal protective equipment are already in place for some cases. So to me, I feel like I still feel confident joining the healthcare industry. Yeah.
Okay. Thank you, Jingrong. Then next to the next question, what are some areas that you see have been improving to help professionals to have like better work-life balance? Because like based on my understanding that health professions can be quite intense. I think maybe Vincent, you can share about like you can answer this question better because you are from an admin position, right? How what improvements have you seen?
Yeah, I think this is a major issue, workload, especially the past 2 years, especially our frontline staff. There's obviously a manpower crunch, I would say. But the management and also MOH has taken a serious look on it. And as far as I know, there's 2 aspects to it. First is the soft policy. There's actually, I can speak for NUHS, there are committees that are formed to look into staff well-being in terms of how to care for our staff by providing them with the right resources to work and giving them the time to do what they like. So we have a well-being day off. We have plans that we allow the department time off every week to do exercises, 30 minutes off on Friday to do exercises. All these are to cultivate a sense of self-care in terms of building bonds between departments and also for yourself. The other aspect is hardware. I would say more and more are being done to increase productivity, and also at the same time reducing the requirements for manpower, such as I'm sure you all know that telecommunication, teleconsult, virtual doctor's appointment is up and rising. I think these are the few things that enable our doctors and nurses to care for more people, but at the same time, reduce the workload. Maybe Diana can chip in now, but I know the management is taking a serious look at it, and I hope over time, as the pandemic is over, things will get better.
Okay, thank you, Vincent. So what I'm hearing is that like there are two things that have been helping healthcare professionals to cope with like the intense workload. One is like better like schedule so that everyone can have more downtime, and also like better technology. So maybe that's why that's also like the medtech industry is also rising in order to help with the manpower issue. Okay. Next up, we have a question for Claudia. Do you think one needs engineering background for P&O? And did the lack of university courses on prosthetic and orthotics ever affected your decision to pursue this course overseas, despite many other university courses in Singapore that offers degree programs for other healthcare disciplines? What made you pursue prosthetics and orthotics? Yeah, I mean, you can see the question in the,
Yeah, okay, I'll do it one by one. Whether you need an engineering background for P&O, you don't need engineering. I think you need like, I think what they require is like at least having taken physics at some point of your education journey. If they deem that your academic, like the subjects that you've taken so far are not enough, they have a bridging program where you can take for 1 year. There's one other Singaporean I know who took a bridging program for 1 year before she started the course. So I think that this can be worked around. For me, I took triple science at during secondary school, so that was enough for me to not have to do the bridging. And I think so far I am not dying yet, so I think it's okay.
I see.
Yeah, so I think it's fine. Yeah, I came here straight from JC as well. So if by engineering background,
were you
mean
BCME? Were you BCME or PCME? Were you like bio? You were a bio student,
I took
right?
biology in JC.
Oh,
I took biology. Yeah. Yeah, I don't
So
think
how
there's any
was the
specific
transition like?
benefits. Sorry?
Oh yeah, how was? Oh, so was it like very? Was it like a very deep, a very steep learning curve for you to like go from a bio student to learn about prosthetic and orthotics?
No. So I think here the level of physics that was necessary was like moments, forces, like just basic. I mean, I wouldn't say it's basic, but like I've learned it at secondary school level. So for me, it was not that bad. For biology, I think that my juniors have said that it was quite difficult for them not having taken bio before to suddenly learn about cell biology. But I think that it's not that bad, personally.
Okay.
Okay, so I'll move on to the next one, the lack of university courses. No, because I think this is it might be quite related to the previous question about whether you might want to separate your passion from your career. I think I approached this in a very practical manner. I thought about my career as whether it would be something I'll be able to do for the rest of my life. And I think that if you want your career to be something that you do for a really long time, you will have to include your passion somewhere. You wouldn't want to do something that you don't like for the rest of your life because that's not very sustainable. So I chose prosthetics and orthotics because of my passion, regardless of whether the course was available in Singapore or not. So if it wasn't in Singapore, I'll just have a work around it. And that's why the scholarship came up as one of the things that I perhaps would have to get if I want to pursue my passion and to do a job that I could love and also keep doing for a long time. Yeah, so that might be a very practical way of doing things. And what made you pursue prosthetics and orthotics? Honestly, the only subject I ever did well in was math. So I was like, will I do well in a science-oriented course? Kind of, okay, math is a science, but arguable. Should I? So that's why I was like considering math-oriented courses at first. Maybe I should go into accounting, because what if I go into healthcare and I just won't make it. But I think when I saw that prosthetics and orthotics had like a rather mathematical science kind of oriented role, I thought, okay, maybe this is something I could actually study for. Like, not that the rest you can't study for, but I think that it's a very methodot that I can't pronounce this word. It's something that I could think through. Like, there is a right answer, and I'm not good with, like, for example, if I'm in, maybe for nursing, okay, I'm not very sure, but maybe if you are in a situation where you have to act immediately, I might not be very good at doing that. I think I'm better at taking it home and being able to think about how to work through my prescriptions as I would with a prosthetics or an orthotics prescription, because I'll be able to work on it as I go rather than make a decision right now. And I think that was what I liked about this, because I was scared to work under a very pressurizing environment.
Okay. Thank you, Claudia. So what I'm hearing is that, like, yeah, what I'm hearing is like, is it it's very important to know like your strengths and weaknesses, and also like know what like the job is like for your you know, so that whether you can do well with your strength in that job, right?
Yes, because I was, like I said, I approached this in a very practical manner. I wanted this career to be sustainable. I wanted to be happy, I would say, with the career, because everybody has to work.
Okay.
And I think if you are struggling in figuring out what you want to do, if you want to do healthcare but you don't know what to do, I think you can consider bringing in your strengths and your weaknesses and considering everything on a maybe objective manner if perhaps you don't know which one.
Okay. Okay. Thank you, Claudia.
Thank you.
I'm seeing a lot of questions from Diana, so maybe we try and clear this first. The first question is, how has the current pandemic affected your mental health, especially so with your job as a nurse? Has it been tough? Maybe you can also share more about your some of your coping mechanisms, and how do you manage that, you know, your work-life balance, especially when you have two kids at home. And okay, let's try to clear those two questions
Okay,
first.
so the first one, how has the current pandemic affected my mental health? So far I'm lucky because my nurse manager have always checked on me whether I'm doing okay in the wards and also in polyclinic. So most of my manager that I came across has been good so far. Has been good so far lah, because I only started in July last year. So how do the other one also in community hospital, they do have support. Like let's say we need someone to talk to, we can talk. There's a platform for us to go. So not to worry. I think not only in community hospital, in other various healthcare organization also, they do have a platform. If let's say you have something that you want to bring out, or like something that affect your mental health, there's always a platform for you to go. So I believe Vincent also might know about this also. Yeah. Then how I have two girls, and how also a scholar and a nurse, how do you do it? I believe in time management. So I have to separate when during my undergraduate days. Definitely it's a very hectic days most of the time. So during one of the weekends, I'll make sure that I spend most of the time with my kids, and then the rest of the day I will plan out my day earlier on lah. So I guess time management is very important, and also a very, very good support system from your family. For example, my spouse, I'm very grateful that he able to look after the kids when I get busy, and also my in-laws also, when I have to go home late or anything, they will just look after the kids for me. And the next one, would you suggest us to do community nursing or emergency nursing first? So it depends. If let's say you like if you love adrenaline rush, emergency nursing is the best for you. So a few years down the road, you may want to venture into community nursing. Yeah. Then would you suggest study a degree or go for degree or nursing diploma? I guess sorry, there's a bit of interruption, so sorry about it. for me, I would prefer for my journey, I prefer to go for experiences first. So I take a 2 years break before I actually decided to go for my undergraduate program. So basically for me, I want to collate all my experiences first. And so when I go into studying, I will be able to relate whatever I have, and then and I'm able to share with my my friends. And when I do projects and all, I'll be able to relate better. Yeah. Is there any more questions?
Yeah, I think that's all. Thank you, Diana.
Thank you.
I think we have time for 2 more questions, if I'm not wrong. Maybe we go with Jingrong first. What is the difference between occupational therapy and physiotherapy, and how did you decide which one to choose?
Okay, before that, I would just like to add for people who are taking physics like PCME, I think there's no need to worry. Yeah, no need to worry if that you haven't had bio background, because actually I didn't take bio since like the compulsory Sec 1, Sec 2 bio, and I think I got through just fine. I mean, it does help, but it's not needed. Yeah. So yeah, just to ease some of the concerns that some people may have. Yeah, because that was one of my concerns. Yeah, then now to answer the question on the difference between OT and PT. So it's a very common question, and sometimes even like working adult, like as OTs or PTs, we do face a bit of difficulties trying to explain it properly. So I'll try my best. But OTs our focus is on occupations, like the activities that people do throughout the day. So yeah, so that's our focus, and we tackle the many factors that may prevent people from being able to do these activities. So the factors could include like mental health, cognitive difficulties, social difficulties, and also the physical part, like fractures or yeah. But on the other hand, PTs, physiotherapists, so they tackle the more physical side of things. So things like gait, like walking, yeah. So theirs is more physical, the body biomechanics, and for us OTs is on the activities. Yeah. So that's the main difference that I can say. Yeah.
Okay. So I imagine like PT is a bit more like what Claudia is doing, like the mechanical, physical side, and OT is like more general, right? And it involves like daily functions and like very broad. Am I correct?
So
It's less specific, in a sense.
It's
okay. Yeah, sorry if I'm wrong.
Yeah, but okay, so like for example, let's say, because normally OTs and PTs will see the same patient. Yeah, because they'll need both OTs and PTs. So for example, if let's say a patient has a stroke, so let's say they have one side of weakness, like the left hand and left leg are weak. So as the PTs, they'll try to get the patient to be able to walk as much as possible again, maybe using a walking stick on the stronger side. Yeah, so this is for like a very mild case of stroke. Yeah. But so then they'll do like the walking part of it, and like the strength base for the strengthening for the hands and the legs, the exercises to help strengthen the muscles. Yeah. Then for OTs, then we do the activities that the patient may face difficulties in, like wearing a shirt using only one hand, or wearing their shoes. Yeah. So yeah, things like that.
Okay. Thank you, Jingrong. Then I think this is going to be the last question for Vincent. Do you mind sharing more about the challenges you think our healthcare will face in the future? And also, can you share more about strategic planning and corporate development? Yeah, I'm not sure what that means, but I think you'll be able to answer it.
That's actually 2 tough questions. So first, challenges wise, I think we are at the transition point, like I mentioned earlier, that the ministry is actually taking a look at how healthcare will be in the next for next generations. It's as you all know, healthcare expenditure cost has been rising. We have an aging population. Everybody knows that. Our people are having longer lifespan. That's a good thing, but with a longer lifespans also means that at a later stage, they are more likely to get disease. So I think one of our major challenges is healthcare financing, which is a very interesting topic on how do we henceforth ensure that our healthcare it's healthcare financing is sustainable, but yet accessible to all Singaporeans when they need it. So I think that is one of the main challenges. And I also want to quickly touch on the second point, which is manpower crunch. I really think we do lack talent. A good aspect would be to see fresh talents, fresh local talents coming into the healthcare sector. This will create vibrancy. I think as what the MOHH team is working really hard into getting scholars into healthcare. I think these are the two main challenges that I foresee. So the second about strategic planning and corporate development, tough questions, but I'm in strategic planning and corporate development office now. It's a department that see the news before it actually happens, work the plans before it actually happens. It's an interesting department where you get to learn a lot and interact daily with senior management. So less on the groundwork, you don't see a lot of operational stuff like hospital daily administration, but you are at the top, you are at the forefront of what is going on. So for example, like NUHS has been working a lot of community health for the past few years, from bringing our patients care from the hospital to the community and the community to the home. So NUHS has been working all along on that, and we can see how at the strategic level, how the different institutions, how the different work plans of our healthcare is coming alongside. So if you like to plan, if you like to see things before it actually happens and be part of it, I think strategic planning is an area that you might be interested in. And of course, that department, you have to read a lot, I would say, in order to figure out what's going on.
Okay, thank you, Vincent. And I think that's all the questions we have for today. Thank you so much for coming in for this session. And I'll pass the floor back to you, Yi-Hui.
Thanks, Fu. Okay, we have come to the end of the session. And once again, I'd like to thank both Claudia, Jingrong, Diana, and Vincent for taking time off their precious Sunday to join us today. So for Fu and the speakers, you may now take your leave. Thank you so much once again. And as we've come to the end of this session, we'd like to remind everyone that we'll have a simple survey launched after this, and we'll be picking 3 lucky winners to win a $10 GrabFood voucher each. And this is actually the end of the session for the Suite of Healthcare Scholarships and Careers Fair 2022. And replay is available for all our sessions till 31st March, 6 p.m. And lastly, just a shout out that applications for most of our scholarship schemes are open, and applications for our scholarship schemes are still open, and majority of them will close on the 31st of March. So do head over to www.healthcarescholarships.sg for the respective application links and to complete your application as soon as possible. Deadlines are drawing near and there will not be any extensions. So thank you once again for joining us today, and see you around. Bye-bye.